Namaste. Hello and welcome to Dr. Chajlani's YouTube video channel series. In this presentation, we are going to talk on how scars behave over time. We all get perturbed when we see a wound healing and see it turning into a scar, which is a mark left after the wound is healed. And a lot of time people ask uninvited questions, which makes us very conscious of our scars. In this presentation, we are going to talk on how scars behave over time and what to expect. If a scar or if a wound is not repaired, then the scar which forms may be pigmented and may be darker in color. Whereas if a surgery is done, then the scar which forms is of better quality. We all must know about first aid procedures and how to take care of the wound. So all wounds can be cleaned and washed with water, and then an antiseptic ointment needs to be applied, and then a non-adhesive dressing and bandage can be given, and which will keep the dressing in place. And all of us must know how to take care of basic wounds. We all should know that the wound changes into a healed and mature scar by a process of wound healing, and it may take more than a year to form a mature scar. Wounds which heal early or by surgery are called primary healing wounds, and those which heal late are called secondary healing wounds or deep wounds. Wounds go through a process of healing when they form a scar, and the first things which may happen is swelling, which can be taken care by ice cold compresses which are applied intermittently. There can be pain, which can be taken care by medications which should ideally be prescribed by a doctor. Antibiotics may or may not be needed. Food, generally the doctor will tell you, but most of the time if it's an injury on the limbs, one can eat everything. Generally stitched wounds and small wounds can be one can have a shower after removing the dressings, and the dressings can generally be removed in 1 to 2 days time, and antiseptic ointment is applied to protect the dressing from sticking. There may be problems like pain, excessive swelling and bleeding. Most of the time the doctor allows you to use cell phones, television and play video games or read books. Sports and games should be are recommended not to be done for 2 to 3 weeks, and stitches are generally removed in 5 days on the face and 10 to 12 days on the limbs. And all wounds or scars go through color changes, and generally after 3 to 4 months the color starts improving, and the best scars are seen after 1 year. Itching is a common problem and it should be avoided. There may be numbness around the scar. Compression dressings may be given if the scar rises above the surface, and 1 to 2% people may have unexpected results. It is difficult to predict how scars will behave, but by and large 98% of the scars would be good scars. And it is important to know that plastic as a material is not used in plastic surgery. When a wound is there, it goes through a process of healing to form a scar, and if it is stitched, it will cause a good scar, and if it is not stitched, the scar which forms may not be ideal most of the time. So scars which are wounds which are not repaired form scars which may be wide and discolored, whereas wounds which have been repaired generally form good quality scars. Nature is the best healer for wounds, and one should give in nature time to act. That's why all scars take time to become mature and be the best scars. Therefore, doing less is often better, and a doctor's opinion is always good. These are layers of skin which get injured when there's an injury. Scar behavior is unpredictable, and two scars on the same limb can behave differently, and different scars in the same person can behave differently. These are scars formed when a patient was not operated, and we can see the quality of scars which are generally wider and generally maybe discolored or maybe raised above the surface if they're allowed to heal on their own, which is called as delayed healing or secondary healing. Whereas when there's an injury or a wound, and if a plastic surgery is done in time, then it forms good scars, and we can see in some of these pictures that these scars, after a period of 1 year, they've matured and formed into good scars. And when somebody goes to a plastic surgeon with a scar, they can also be improved in quality, but they also go through the same process and take about a year to form best scars. Stria or stretch marks are scars which are difficult to remove by surgery, therefore laser is the recommended choice. And we must realize that time is the most important factor in wound healing and scar maturation. Bad scars may not improve, but good scars may become better. And keloids and hypertrophic scars form in few patients.
Thank you and welcome once again.